name's Maddie. I'm going to be your nurse today. Before we get started, I'm just going to go ahead and wash my hands. And we'll provide some privacy. Can I just get your name and your date of birth? I'm just going to go ahead and compare it to your wristband. Awesome. It looks like I'm in the right room. All right, so it looks like your doctor has ordered the placement of an NG tube today. So we're going to be inserting that. I'm going to go ahead and take all of your vital signs before we get started just to kind of get that out of the way. And all of her vital signs are normal. I also just did want to ask, on a scale from 0 to 10, with 0 being no pain and 10 being the worst pain, how are you feeling today? A 0? Awesome. All right. So I'm going to go ahead and sit the head of your bed up, if that's okay with you. All right, feeling comfortable? I'm just going to go ahead and raise your bed up to a good height. I'm going to put this pulse oximeter on your finger. We're just going to keep that on throughout the procedure. And then I did want to ask, do you have any history of a deviated septum, breaking your nose, surgeries, things like that? No? None? All right. I'm going to go ahead and just inspect your mouth, looking inside. If I had a pen light, I could use that to get a better look. And then go ahead and I'm just going to have you cover one side of your nostril and just breathe out through the other one. Good. And the other. All right. We're going to go ahead and insert it on your left nostril today, if that's okay with you. Perfect. All right. Let's just wash my hands. We're going to go ahead and get started. Put some gloves on. And we'll try to make this procedure as fast as possible. It is a little bit uncomfortable. You may feel a little bit of pressure. You might gag, but I'm going to check in with you throughout the whole procedure and you let me know if you're uncomfortable. I'm also going to check your gag reflex just real quick, okay? All right. And get our tube ready. Get some lube to make this insertion process just a little bit easier. All right, we're gonna go ahead and measure. So I am just measuring from your nose to your ear, and then we're gonna measure from your ear to your xiphoid process, and then we're going to add about 15.2 centimeters, and then I'm at 45 right now, and we would just go ahead and mark this with a water-soluble marker. Right. Just going to go ahead and dip this in the lube. Get all lubed up. All right, I'm gonna give you this cup of water throughout the procedure. Just have you hold it in your right hand. And we're just gonna have you take some sips while I'm doing the insertion. It'll just make it a little bit easier as it goes down, okay? And we're just gonna do it really quickly. Do you have any questions before we get started? No? All right. So I'm gonna go ahead and have you just look up for me. Ready? And sip, 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 and I'm inserting it back towards your ear. All right, doing okay? Okay, go ahead and look down for me and sip, sip, sip. You're doing great. Perfect. All right. It's in, how you feeling? Doing okay? We're gonna go ahead and just secure this to your face. Did a great job. No, it's a very uncomfortable procedure. Oops. We're just gonna go ahead and fasten this to your cheek as well. Just gonna make it so it doesn't pull on anything. And then I'm going to fasten it to your gown as well. So if you get up at all, just be careful. But this will just keep it from pulling and getting caught on things. Doing okay still? I'm gonna go ahead and provide some mouth care just to kind of clean out your mouth. Anything is in there. I'm also just gonna go ahead and check with my pen light just to make sure that I can see the tube in the back of the patient's throat. And I can, so it's looking good. Gonna discard this in my garbage. I'm gonna go ahead and take off my gloves really quick and just wash my hands. Put on a new pair. All right, since we've got that tube inserted now, I'm gonna go ahead and we're gonna aspirate some of your gastric contents. We're just gonna check the pH of it and make sure everything that's going on in there is okay. So I've got my irrigation kit. And then I'm just gonna put this little drape over your chest, okay? Just so we don't get any water on your clothes or anything. Perfect. All right. So we're gonna go ahead and take my syringe. I'm gonna draw up 10 mils of air. Alcohol swabs. Just gonna make sure this port is nice and clean. And I would let that air dry, not fanning or anything. Right. This might feel a little bit weird, but I'm just gonna inject some air into your tube. And then we are aspirating for gastric contents. I'm gonna draw up between 5 to 10 mils. And we're going to empty this into a clean medicine cup. And I would discard this and get a new irrigation system. I'm gonna take our pH strip and test it in the fluid. And I would just let that sit for a second, and then we would compare it against our provider's chart. And now we're gonna go ahead and we're just gonna irrigate your NG tube just to kind of flush that out. I can either use room temperature water or sterile NS, but I would fill my container up. We're going to draw up another 10 mils. And then just gonna go ahead and clean that port again, making sure it stays nice and clean since this is going into stomach. Still feeling okay? All right. Just gonna put that back in and insert that water. Just Just irrigating. All right. So all done with that, okay? I'm gonna go ahead and clean everything up. And then your doctor has also ordered that we hook you up to suction. It won't be for too long, but I'm gonna go ahead and throw a few things away and then we'll get started, okay? And I can check my pH now, and it is within normal range. Clean that port again. And I would make sure when I am uncapping the NG tube at all before I insert or draw out any liquid, that I'm always making sure to clamp my tubing just so nothing is coming out of that tube, especially when inserting and drawing fluid out. Let's get my Lopez valve. Making sure it's in the off position, and inserting it in. I'm gonna grab my suction. And I would clean this side as well with the swab, even though it's clean because it's in the packaging. Hooking it up. Making sure that valve is open. And then we are going to turn our suction on to what the doctor has ordered. And normally this isn't for a long amount of time, it's just a short-term thing. All right, doing okay? Probably feels a little bit weird. All right, I'll be right back. I'm gonna clean up the rest of my supplies, and then I'll be right back, and then we can turn that suction off. Wash my hands again. On a new pair of gloves. All right, we're gonna go ahead and turn your suction off, and it looks like your doctor has also ordered that we go ahead and discontinue your NG tube today. So once I turn that off, we'll go ahead and get that thing out of you. Right, just gonna disconnect that. I'm gonna turn this valve off first. Perfect, and then taking that off. Making sure that's clamped, and then I put my little stopper in here. And then I'm going to go ahead and throw this guy away. Trash. All right, we're gonna go ahead and discontinue your tube now. I'm just gonna take our little adhesives off. It's gonna feel a little bit uncomfortable again because it's coming out this time. But I'm just gonna have you, before I take it out, where you're just gonna take a deep breath in and hold it while I take that out. And I would be super careful taking off this adhesive just because it might be irritating to the patient's skin. All right, go ahead and take a deep breath for me, okay? We're gonna go ahead and take it out. All right, how you doing? Is that okay? Just gonna coil that up, making sure to keep it inside of my glove. I'm throwing that away. Gonna wash my hands. All right, how you feeling, okay? I'm just gonna go ahead and look at the inside of your mouth, and then we're gonna provide some more oral mouth care. Make sure everything inside there is clean. And then if they have anything on their nose or anything, I would clean that up as well. But that's it. How are you feeling? Any pain on a scale from 0 to 10? No? Okay, I'm gonna go ahead and lower your bed again. And you might be a little bit uncomfortable for a little bit just since we did just take that tube out. And then I'm just gonna lay you all the way back. Here's your call light. And then if you have any questions, I'll be in a little bit and I will let your doctor know that we got that tube discontinued.